This is a video where we talk about VOR training and size matters. Of the utmost importance, however, is a big thanks to Cameron Barine for not only giving me permission to use this, but giving me permission on countless times. I think you'll be really excited about taking a deeper dive into this busy chart. So a lot of our patients come to see us with movement-related dizziness, particularly with rapid head movements. So a typical head movement, a rapid head movement, as if someone was saying your name and you turned to look, is a little over 100 degrees per second. Most of you are familiar with talking about VOR exercises in hertz and maybe converting that to beats per minute. But what we don't talk about enough, I think, is the size of the head movement. I think we all know to keep it pretty small, less than 30 degrees, but we know the importance of targeting VOR training. So what Dr. Barine has done is he has taken into consideration the size of the head movement or the amplitude, what is the desired head velocity, which is on the y-axis there on peak head velocity in degrees per second, and how we can customize their VOR training to a metronome by beats per minute, which is on the x-axis. And also on the x-axis, you'll see beats per minute head turn, meaning that the person turns their head to each beat of the metronome. And that's represented in the picture on the far right. So it's like beat, 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 and each beat to the metronome, they're turning their head. So let's say someone, again, has dizziness with rapid head movements. You don't have the technology available to customize exactly where that VOR breaks down, so you're going by their symptoms. So in this case, we'll pick 100 degrees per second. It's just below the average speed of a head movement involved in daily activities. So maybe that's where you want to start them. We're going to choose the green line because we're going to have them move their head about 20 degrees side to side. And we're going to target it at 100 degrees per second, maybe just below where they're where they have significant symptoms. And so we're going to set the metronome at 100 beats per minute. So you can see in that chart next to the graph is at 100 beats per minute, we've got an amplitude of head movement at 20 degrees side to side at about 105 degrees per second. So those of you who have taken a big interest in the more recent literature that suggests that 156 beats per minute are needed to actually have a change in VOR gain. And that is obviously well below that, but it's okay. This is where you can start your patients. It's very targeted. This may not be resulting in actual VOR gain adaptation, but it's highly likely that your patients are going to report an improvement in symptoms and also show improvements when you retest them on the dynamic visual acuity test. So just to wrap a couple of other points out on this is you'll see at the bottom that 251 is in green, and that's just an example of someone's moving the head side to side 20 degrees. We've got that metronome at 240 beats per minute because they're moving their head to each beat. So that's equivalent to 2 hertz. If you want to do 120 beats, then the patient would need to complete a complete cycle from one side to the other in that second. So this becomes a preference of how you like to set the metronome. So just to wrap things up, the circles, the blue circles on this, so show 157, 157, 157. Those were just things I pointed out based on what I just mentioned on the more recent literature that suggests that a minimum of 156 beats per minute, if you're having them change head direction in each beat, is needed for true VOR adaptation. If you have questions about this, please go to the Ask Your Questions section because, I'm really excited to have continued conversations about this. I think it provides us a great opportunity to target our VOR training. So thanks to Dr. Barine.